I was 44 years old, not getting enough sleep, running ragged with kids and sports and work and just normal stresses.
And he called a friend who had just had a heart attack, and his symptoms were the same.
And I was very lucky that hearing those symptoms, I went to see my family doctor, and she ordered a stress test, and they told me I had something called an ST depression.
And our Inspira friends got us in immediately to Dr. Kurt Callback.
Dr. Callback examined me and said that within a couple days, we should go do an exploratory cardiac cath, and if needed, ask my permission to do a stent. The initial stenting procedure was pretty simple. I went in the morning, I was out in the afternoon, and then unfortunately about a year and a half later, I started to see symptoms again of just feeling tired.
His run times weren't as fast. He wasn't feeling good after the runs. I knew it was time. I knew an open heart surgery was coming.
So at that point, I went back to see the cardiologist. I was offered minimally invasive bypass surgery for one vessel, but knowing that the other blockages were there, I sort of volunteered to have triple bypass and get it done at 46 years old rather than wait till maybe 60 years old when I wouldn't be as in good shape.
The part that's hard is watching your vibrant husband be incapacitated and laying there. He had the best attitude of any patient ever. I know when I gave birth to my children, I didn't have that good of an attitude. So to see him going through open heart surgery with such a great attitude, but yet suffering, it's hard to watch your family member go through that.
After that, I did cardiac rehab here at Inspira. I had amazing nurses and people helping me at cardiac rehab. It is very individualized care based on what my abilities were. So I wanted to get back to running 25 miles a week was my initial goal. And they built a rehab program around that. I'm very lucky that I have no damage to my heart because I caught this and was paying attention before I had a heart attack. I still run 6 days a week, 100 miles or so a month. I'm on very little medication, and I just go in for routine checkups. So my cardiac journey from this point forward is that of any other 47-year-old. The things that are important for me to fund for my children, for my children's children, are investments in things like this. It will always be important for us as a family to support community. Philanthropy is just a natural extension of us in our journey in supporting.
We saw other community members donating to build Inspira here in Mullica Hill. And we were encouraged and overwhelmed by their generosity and thought, wow, they are giving for the next generation. And so now my husband and I want to make that same investment for our next generation.
So the All Heart campaign is a network-wide campaign to improve cardiac care across the entire network. We need expanded cath lab capability in Vineland because the procedure that I had done at Cooper Hospital with Inspira Doc wasn't available at Inspira then. Once the state removed the barriers to non-emergent stenting, we now have that ability to do that in Vineland and Mullica Hill. In Vineland, we need an additional cath lab. There's a lot of money that goes into doing construction inside an active hospital who cannot shut down and needs to build another cath lab inside the hospital. Here in Mullica Hill, we need some equipment, and maybe little known is the expansion of facilities in Deptford to include cardiac rehab, which again was near and dear to me because I did cardiac rehab here at Inspira. So it's truly a network-wide focused campaign to expand cardiac care across our community hospital network.
The All Heart campaign is raising funds to expand cardiac care in our local communities. And I'm very excited for that because that could affect my children, because the cholesterol issue that my husband has is genetic. It's not necessarily because of what he eats. We have changed our diet to help that, but it's genetic. And so my boys have a very high chance of having the same cardiac issues that my husband has. Therefore, this All Heart campaign is very important to us for the next generation.
The All Heart campaign is necessary because 1 in 4 deaths in the United States are from cardiac issues. Elective PCI needs to be done in our network area and has never been done before. There are approximately 1,000 patients a year that leave Cumberland County to have a non-emergent stent put in prior to the expansion in this capability. Some of those people are diagnosed and we know don't go get stents because they can't travel, they can't take a day off work and do the things that requires. And this is the #1 killer in America and has been for a long, long time. And we need to have expanded care in order to change that number. I'd really just like to say a special thank you for all the contributors that are considering the cardiac campaign and considering the impact they may have on the future of healthcare in South Jersey. I'd also love to say thank you to Dr. Callback, to all the nurses, doctors, staff, logistics people that make all these things happen. It takes a massive organization to make great healthcare in South Jersey, and I am very thankful to be a part of Inspira for all that they did for me.
If you are interested in contributing to the All Heart campaign, we would ask that you go to inspirafoundation.org/allheart.